The mountain collapsed at 3:47 p.m. on a Tuesday, burying half of Pine Valley under tons of rock and debris. As rescue teams declared the situation too complex for civilian medical response, a quiet family doctor stepped forward and began barking orders that nobody questioned because something in her voice carried the authority of someone who had saved lives in war zones. Welcome to the Story Collective, where ordinary faces hide extraordinary pasts, and heroism speaks not in words, but actions. If you believe legends only wear uniforms, think again. Now tell us in the comments, where are you watching from today? Let's begin. The morning of September 15th had started like any other Tuesday in Pine Valley, Colorado. Dr. Sarah Mitchell unlocked the door to her family practice at exactly 7:45 a.m., 15 minutes before her first appointment. The small mountain town of 3,200 residents knew her as the gentle physician who had moved there 8 years ago, seeking a quieter life after what she simply called government service. Her practice occupied a converted Victorian house on Main Street, its waiting room filled with worn but comfortable chairs and outdated magazines. Sarah's approach to medicine was unhurried and thorough. She listened carefully to her patients, treated everything from childhood ear infections to elderly arthritis, and never seemed rattled by medical emergencies. To her patients, she was Dr. Mitchell, who remembered their children's names, asked about their gardens, and always had time to explain medical conditions in terms they could understand. She drove a modest Honda Civic, lived alone in a small cabin outside town, and volunteered at the local animal shelter on weekends. What the residents of Pine Valley didn't know was that before Dr. Sarah Mitchell had treated seasonal allergies and routine checkups, she had been Major Sarah Mitchell, MD, one of the most decorated field surgeons in the U.S. Army. For 12 years, she had operated in forward surgical teams in Iraq and Afghanistan, performing life-saving procedures under enemy fire, in makeshift operating rooms, and with resources that would challenge even veteran trauma surgeons. During her military career, she had conducted over 2,400 combat surgeries, pioneered several battlefield medical techniques, and trained hundreds of medics in advanced trauma care. Her record was extraordinary, a 94% survival rate for patients who reached her operating table alive, even under the most challenging combat conditions. But that was before the incident that ended her military career. 3 years before her retirement, during what should have been a routine mission in eastern Afghanistan, Major Mitchell's forward surgical unit had come under sustained enemy attack. A mortar round had struck the medical tent, killing 2 medics and critically wounding 6 patients who were in the middle of surgery.
With the facility compromised and evacuation impossible, Sarah had continued operating by flashlight for 14 hours straight, keeping 7 critically injured soldiers alive until reinforcements arrived. She saved every patient, but the psychological toll of performing surgery while under attack, surrounded by the bodies of her colleagues, had left scars that went deeper than any physical wound. She had completed her service commitment, received commendations for her actions, and quietly left the Army. The transition to civilian practice in Pine Valley was supposed to be therapeutic, treating routine ailments instead of combat trauma, working in a peaceful environment where the most serious emergency might be a heart attack or broken bone. For 8 years, it had worked. Sarah found purpose in providing care to a community that appreciated her dedication, and she gradually buried the memories of surgical tents, improvised operating rooms, and the constant pressure of battlefield medicine. Until 3:47 p.m. on September 15th changed everything. Sarah was in her office, finishing notes from her afternoon appointments when the earthquake struck. The initial tremor felt like a large truck passing by, but within seconds, the building began shaking violently. She dove under her desk as medical supplies crashed from shelves and the lights went out. The earthquake lasted 93 seconds, long enough to fundamentally alter Pine Valley's landscape and trap dozens of people under collapsed structures. When the shaking stopped, Sarah emerged from her office to find Main Street transformed into a disaster zone. The old Pine Valley Shopping Center, a 3-story building that housed a grocery store, pharmacy, and several small businesses, had pancaked into rubble. Cars were buried under debris from collapsed storefronts. Power lines sparked and hissed where they had fallen across the street. But it was the sounds that immediately transported Sarah back to combat zones. The screaming, the calls for help, the voices of people trapped and injured. Her medical training kicked in instantly, but more than that, her battlefield instincts awakened. She ran back into her damaged office and grabbed the large medical kit she kept in her supply closet, a kit that her Pine Valley patients would have found surprisingly comprehensive for a small-town practice. It contained surgical instruments, trauma dressings, IV supplies, and medications that went beyond what most family doctors would stock. As she reached her car, the first emergency responders were arriving. Pine Valley's volunteer fire department and single ambulance were clearly overwhelmed by the scope of the disaster. She could see Fire Chief Roberto Martinez standing near the collapsed shopping center, speaking urgently into his radio.
This is Chief Martinez. We need immediate assistance from County Emergency Services. Multiple structure collapse. Unknown number of casualties. We're going to need every available ambulance and rescue team. Sarah approached him, her medical bag in hand. Chief Martinez, I'm Dr. Mitchell. How can I help? Martinez looked relieved to see her. Doc, thank God you're here. We've got people trapped in the shopping center. I can hear voices, but we can't get to them safely. The whole structure is unstable. Sarah looked at the collapsed building. Her trained eye immediately assessed the situation. This wasn't just a medical emergency. It was a mass casualty event, requiring triage, field treatment, and coordinated rescue operations. The kind of scenario she had managed dozens of times in battlefield zones. Chief, we need to establish a treatment area immediately. How many people do you estimate are trapped? Could be 30, 40 people, maybe more. The grocery store was busy and there were people in the upper floor offices. Sarah's mind shifted into the mode she hadn't accessed in 8 years, battlefield medical command. She began issuing orders with an authority that surprised everyone within earshot, including herself. We need a triage area set up here, she said, pointing to the parking lot across from the collapsed building. Clear that space of debris. I need tables, blankets, and every first aid kit in town. Also, get someone to bring all the portable lights they can find. Martinez stared at her for a moment. The quiet family doctor had suddenly transformed into someone who spoke with the confidence of a person accustomed to managing life and death emergencies. Doc, are you sure you can handle something like this? Chief, I need you to trust me and follow my instructions exactly. Lives depend on it. Something in her voice, the calm authority, the absolute certainty, made Martinez nod immediately. What else do you need? Radio County Emergency and tell them we're establishing a field treatment facility. We'll need trauma supplies, IV fluids, and at least 6 more qualified medics. Also, tell them to send their most experienced rescue team. As Chief Martinez coordinated with emergency services, Sarah began setting up what she knew would become the center of Pine Valley's disaster response. She directed volunteers to arrange tables into a trauma bay configuration, established supply stations, and created a system for categorizing injuries by severity. But more than organizing the response, she was preparing herself mentally to return to the kind of medicine she had left behind. Surgery performed under extreme conditions, with limited resources, where every decision could mean the difference between life and death. The first trapped victim was extracted 23 minutes after the earthquake.
Tommy Rodriguez, age 12, had been caught under a collapsed section of the pharmacy when he'd gone in to pick up his grandmother's medication. He was conscious, but had suffered a compound fracture to his left leg and possible internal injuries. As the rescue team carried Tommy to the triage area, Sarah immediately took charge. One look at the boy's condition triggered responses she hadn't used in 8 years but had never forgotten. "Severe compound fracture, possible internal bleeding," she announced to the volunteers who had gathered around. "I need IV access established immediately. Someone get me normal saline and start a line in his right arm." Tommy's mother, Maria Rodriguez, was crying and trying to reach her son. Sarah gently but firmly moved her aside. "Mrs. Rodriguez, Tommy is going to be okay, but I need space to work. Can you help by keeping other families calm?" Sarah's hands moved with practiced efficiency as she assessed Tommy's injuries. The compound fracture was severe, bone protruding through the skin, significant bleeding, possible nerve damage. In a normal setting, this would require an ambulance ride to a level 1 trauma center and hours of surgery. But Pine Valley was 45 minutes from the nearest hospital. The roads were damaged, and more casualties were being extracted from the collapsed building. Sarah realized she might need to perform procedures she hadn't done since Afghanistan. "Tommy, I'm Dr. Mitchell. You're hurt, but I'm going to take care of you. This might hurt a little, but I need you to stay very still." As she worked to stabilize the fracture and control bleeding, Sarah felt muscle memory taking over. Her hands knew exactly how to apply pressure to stop arterial bleeding, how to immobilize the injury, how to work efficiently under pressure. The sounds of the disaster zone, sirens, shouting, crying, faded into background noise as she focused entirely on her patient. "Dr. Mitchell," called one of the volunteers, "they're bringing out more people, a woman and 2 children." Sarah looked up to see rescue workers carrying 3 more victims from the rubble. One of the children appeared unconscious, the woman was bleeding from a head wound, and the second child was screaming in pain. In that moment, Sarah realized that her 8-year retreat from battlefield medicine was over. Pine Valley needed the skills she had developed in combat zones, not the gentle bedside manner of a family practice doctor. "Listen carefully," she said to the growing crowd of volunteers. "We're about to receive multiple trauma patients simultaneously. I need everyone to follow my instructions exactly, without question." She quickly designated roles: triage assistant, IV team, supply coordination, family liaison. Her voice carried an authority that made people respond immediately, even those who had known her only as the quiet doctor who treated their colds and checkups. The next 6 hours would test every skill Sarah had developed during 12 years of combat medicine. As more victims were extracted from the collapsed shopping center, she found herself managing injuries that ranged from minor cuts to life-threatening trauma. A 67-year-old man with crushing injuries to his chest and abdomen, a young mother with severe lacerations and possible spinal injuries, a store clerk with a traumatic amputation of his left hand, an elderly woman in cardiac arrest. Each case required split-second decisions about resource allocation, treatment priorities, and surgical intervention. Sarah operated in conditions that reminded her of Afghanistan: insufficient lighting, limited supplies, no backup, and the constant pressure of knowing that every decision affected whether someone would live or die. But there was one crucial difference. She was no longer Major Mitchell following orders from military command. She was Dr. Mitchell, making her own decisions, using her skills to serve a community that trusted her completely. The most challenging case came 4 hours into the rescue operation. 15-year-old Ashley Walker had been trapped under heavy debris for over 3 hours. When the rescue team finally reached her, it was clear she had suffered severe internal injuries and was going into shock. "Multiple trauma, possible internal bleeding, blood pressure dropping," Sarah announced as they brought Ashley to the triage area. "I need O-negative blood if we have it, and prep for emergency surgery." Ashley's father, Mike Walker,
who owned the local hardware store, grabbed Sarah's arm. "Dr. Mitchell, please, she's all I have left." Sarah looked into his eyes, the same desperate look she had seen on countless faces in combat zones. "Mike, I'm going to do everything possible, but I need you to trust me and let me work." Ashley's condition was deteriorating rapidly. The kind of internal injury she had sustained required immediate surgical intervention, but the closest operating room was 45 minutes away, assuming the roads were even passable. In Afghanistan, Sarah would have performed the surgery in a field hospital, but this was Pine Valley, Colorado, not a military base. "Dr. Mitchell," said Chief Martinez, "the county medical team is still 20 minutes out. Can she wait?" Sarah assessed Ashley's vital signs, blood pressure continuing to drop, pulse rapid and weak, signs of severe internal hemorrhaging. In 20 minutes, Ashley would likely be beyond saving. "Chief, I need to operate now. Here." "Here? In the parking lot?" "We don't have a choice. Get me better lighting, sterile drapes, and clear this area of everyone except essential personnel." What happened next challenged everything Sarah had believed about leaving her military medical career behind.
She was about to perform emergency abdominal surgery in a disaster zone, using skills she had developed in combat to save the life of a teenager whose father trusted her completely. As volunteers set up portable lights and cleared the area, Sarah prepared for the kind of surgery she had hoped never to perform again. But as she looked at Ashley Walker, unconscious, injured, depending entirely on her skills, she realized that some callings don't allow for retirement. Sarah scrubbed her hands with antiseptic solution, while volunteers arranged sterile drapes around Ashley's unconscious form. The improvised operating area was lit by a combination of vehicle headlights and battery-powered LED panels that cast harsh shadows across the makeshift surgical field. "I need complete silence during this procedure," Sarah announced to the crowd of rescue workers and volunteers who had gathered around the triage area. "Anyone who isn't directly assisting needs to step back and maintain security around this area." As she prepared to make the first incision, Sarah felt the familiar calm that had always settled over her during combat surgery. The chaos of the disaster zone faded into background noise as her focus narrowed to the patient before her and the surgical task at hand. The operation revealed severe internal bleeding from a lacerated spleen and liver damage. Under normal circumstances, this would require a fully equipped trauma center, multiple surgeons, and hours of careful work. Sarah had none of those advantages, only her hands, basic surgical instruments, and the knowledge gained from performing similar operations under enemy fire. "Suction," she said quietly, working to control the bleeding while assessing the extent of Ashley's injuries. "I can see the primary source. Clamp." For 47 minutes, Sarah operated in conditions that would have challenged surgeons at major medical centers. Every movement was precise, efficient, and informed by years of experience saving lives under impossible circumstances. The volunteers who assisted her watched in amazement as the quiet family doctor they thought they knew performed surgery with a skill and confidence that seemed to come from a different world. Her hands moved with absolute certainty, her voice remained calm, and her decisions were made without hesitation. "Blood pressure is stabilizing," reported Janet Williams, a retired nurse who had been helping with patient monitoring. "Pulse is getting stronger." Sarah looked up from the surgical field for the first time in nearly an hour. "She's going to make it. We stopped the bleeding, and there's no other major organ damage." Mike Walker, who had been waiting anxiously behind the security perimeter, broke down in tears. "Dr. Mitchell, I don't know how to thank you."
Sarah cleaned her hands and looked at the man whose daughter she had just saved. "Mike, she's not out of danger yet. We need to get her to a trauma center for follow-up care, but she's stable." As they prepared Ashley for transport to the regional medical center, Chief Martinez approached Sarah.
Doc, I've never seen anything like what you just did. Where did you learn to operate like that? Sarah looked around the disaster zone, at the victims she had treated, the volunteers who had followed her instructions, the community that had trusted her with their most critical emergency. For 8 years, she had hidden her military medical experience, believing that chapter of her life was over. Chief, I used to do this kind of work in different circumstances. I thought I was done with trauma medicine, but apparently, trauma medicine wasn't done with me. The earthquake response continued through the night. By dawn, Sarah had treated 37 patients with injuries ranging from minor cuts to life-threatening trauma. She had performed 3 emergency surgical procedures, coordinated the medical response for the entire disaster, and supervised the treatment of every person extracted from the collapsed shopping center. More importantly, she had saved lives that would have been lost if not for her willingness to use skills she had tried to leave behind. As the sun rose over Pine Valley's damaged but surviving community, County Emergency Services Director Patricia Hayes arrived to assess the disaster response. She had expected to find a small town overwhelmed by an emergency beyond their capabilities. Instead, she found a well-organized medical operation that had successfully managed a mass casualty event with minimal loss of life. Who coordinated the medical response? Hayes asked Chief Martinez. Dr. Sarah Mitchell, our local family practice doctor. She set up the triage center, performed emergency surgery, and basically ran the entire medical operation. Hayes looked at the improvised treatment area, still organized like a battlefield medical station, with clear zones for triage, surgery, and patient transport. Chief, this looks like it was organized by someone with extensive disaster medicine experience. That's what we all thought, but Dr. Mitchell has been our quiet family doctor for 8 years. We had no idea she could do anything like this. Hayes requested a meeting with Sarah, who was finishing patient documentation in what had been her makeshift command center. When Hayes introduced herself, Sarah looked exhausted but alert. Dr. Mitchell, I understand you coordinated the medical response for this disaster. Can you walk me through your background and training? Sarah hesitated for a moment. For 8 years, she had kept her military service private, telling people only that she had worked for the government before coming to Pine Valley.
But the events of the past 18 hours had made it clear that her past was no longer something she could keep buried. I served 12 years as an Army field surgeon, including multiple deployments to combat zones in Iraq and Afghanistan. I specialized in trauma surgery and combat medicine before retiring and transitioning to family practice. Hayes stared at her. Dr. Mitchell, are you telling me that Pine Valley's family doctor is a former military trauma surgeon? That's correct. I came here to get away from that kind of medicine. I wanted to treat routine illnesses and help people in a peaceful setting. But last night, you single-handedly managed a disaster that would challenge experienced emergency response teams. You performed surgery in a parking lot and coordinated a medical operation that saved lives. Sarah looked out at Pine Valley's Main Street, still littered with debris but showing signs of recovery. Miss Hayes, I realized last night that some skills aren't meant to be retired. When people's lives are at stake, you use whatever abilities you have to help them. Hayes leaned forward. Dr. Mitchell, I want to offer you a position with the state's disaster response team. We need someone with your experience and leadership skills to help train other rural communities in emergency medical response. Sarah was quiet for a long moment. For 8 years, she had successfully avoided the high-pressure, life-and-death decision-making that had defined her military career. But the earthquake had forced her to confront an important truth. Her skills as a trauma surgeon and emergency medical coordinator weren't just part of her past, they were part of who she was. Miss Hayes, I'm not interested in leaving Pine Valley, but I would be willing to develop training programs that could be implemented in rural communities that might face similar emergencies.
Over the following months, Sarah found herself balancing her family practice with a new role as a consultant for rural disaster medical preparedness. She developed training curricula, conducted workshops for first responders, and helped small towns establish emergency response protocols that could function effectively until outside help arrived. But more than that, she discovered that integrating her military medical experience with her civilian practice made her a more effective doctor overall. The confidence and decision-making skills she had developed in combat zones served her well when treating routine medical emergencies, and her understanding of trauma psychology helped her provide better care to patients dealing with various life stresses. 6 months after the earthquake, Sarah received an unexpected visitor. Colonel Michael Thompson, her former commanding officer from Afghanistan, had driven to Pine Valley after hearing about her role in the disaster response.
Major Mitchell, he said, using her former rank. I read the reports about your response to the earthquake. Sounds like you haven't lost your touch. Sarah invited him into her office, which had been rebuilt and expanded after the earthquake damage. Colonel Thompson, it's good to see you, though I'm just Dr. Mitchell now. Sarah, I'm here because the Army's developing a new program for retired medical officers who want to provide disaster response training. We need someone with your combination of combat experience and civilian medical practice to head the program. Sarah looked out her office window at Main Street, where construction crews were still working to repair earthquake damage. Colonel, I appreciate the offer, but I've found my place here in Pine Valley. I'm not asking you to come back to active duty. I'm asking you to help train the next generation of military medics in the kind of skills that you used during the earthquake response, skills that could save lives in disaster zones around the world. Sarah thought about Ashley Walker, who had made a full recovery and was now a senior in high school, about Tommy Rodriguez, whose leg had healed perfectly and who was playing baseball again, about the 37 people whose lives had been affected by her decision to use skills she had tried to leave behind. Colonel, if I do this, it has to be on my terms. I maintain my practice here, I train people to think for themselves in crisis situations, and I focus on preparing medics to handle disasters in civilian settings as well as military ones. Colonel Thompson smiled. Major, Dr. Mitchell, that's exactly what we need. The Rural Emergency Medical Training Program was established 8 months later, with Sarah as its director. The program combined military field medicine techniques with civilian disaster response protocols, creating a curriculum that prepared medics, paramedics, and doctors to function effectively in crisis situations with limited resources. Sarah's approach was unique. She taught not just medical techniques, but the mindset required to make life-and-death decisions under extreme pressure. Her students learned to assess disasters quickly, establish treatment priorities, and coordinate medical responses even when normal communication and supply chains were disrupted. The most important thing I can teach you, Sarah would tell her students, is that medical training means nothing if you're not willing to use it when people need you most. Your skills don't belong to you, they belong to the community you serve. 1 year after the earthquake, Pine Valley held a memorial service for the 3 people who had died in the disaster and a celebration for the 37 people who had survived thanks to the community's emergency response.
Sarah was asked to speak at the service, representing the medical response team. When the earthquake struck, she said, looking out at the assembled crowd that included many of the people she had treated that night, I was forced to remember something I had been trying to forget. That being a doctor isn't just about treating routine illnesses. It's about being ready to use your skills when people face their worst moments. She paused, looking at Ashley Walker, who was sitting with her father in the front row.
What I learned that night is that we all have abilities that we sometimes try to leave behind, thinking they belong to a different part of our lives. But when our community needs us, when people are counting on us, those abilities become exactly what the world needs. After the service, Dr. Sarah Mitchell returned to her practice on Main Street. But now her office included a disaster preparedness training center. Her staff included paramedics cross-trained in rural emergency response, and her role in Pine Valley extended far beyond treating routine ailments. She had discovered that the skills developed in one part of her life, the trauma surgery, the crisis leadership, the ability to make critical decisions under pressure, weren't meant to be buried. They were meant to be integrated into everything she did, making her not just a better doctor, but a more complete person. The earthquake had lasted 93 seconds, but it had taken a lifetime for Sarah to understand that some callings don't allow for retirement. They evolve, they adapt, but they never really end. In the years that followed, Dr. Sarah Mitchell would train hundreds of medical professionals in rural emergency response. She would develop protocols used by disaster response teams across the country. She would return to Afghanistan as a civilian consultant, training military medics in techniques she had pioneered in Pine Valley. But more than any of those accomplishments, she had learned that the most important surgery she could perform was on her own understanding of what it meant to serve. The skills she had developed in battlefield medicine weren't a burden to be escaped. They were tools to be used for the benefit of everyone who needed them. And in Pine Valley, Colorado, the quiet family doctor who had once been Major Sarah Mitchell, MD, continued to prove that heroes don't always wear uniforms. Sometimes they wear white coats and stethoscopes, and they save lives one patient at a time, using whatever skills they have to ensure that everyone makes it home safely. The woman who had tried to leave battlefield medicine behind had discovered that the most important battlefield was the one where ordinary people faced extraordinary challenges, and the most heroic surgery was the one that helped them survive to see another day.